Hello? You're here for your ear exam, am I right? Of course I am. Well, could you please tell me, do you have any complaints regarding your hearing? Maybe you have any kinds of concerns or something you'd like to discuss with me? Well, have you noticed any changes that are related to your hearing and the quality of the sound? Well, and what about some kind of injuries? Have you had any lately? Around your head, your neck, your ears, or any other kinds of injuries? Have you had any accidents lately? Right. How did it happen? And have you noticed any changes in your senses since then? Okay. Well, there can be multiple reasons for that. I would say that sometimes it can be some innocent wax buildup in your ear canal, and sometimes it can be something more serious related to your cranial nerves or some other kinds of mechanical injuries and stuff. So I would say that there can be plenty of reasons, plenty of things that can cause some kind of troubles in hearing. And I guess that we'll do a hearing test, actually a few of them, different ones, like the test with the tuning fork, the beep test, some other kinds of hearing tests, just to see if that's something rather related to your cranial nerve or something that can be connected to something else. And of course I will have a look at your ears. I'll inspect them really well, so you don't need to worry about anything. I'll just have a look at both of your ears, and I will tell you if I can see anything, like visually any obstacles that could also cause some hearing problems for you, okay? Because yes, sometimes it can be quite visible, especially if that's something in your ear canal. Right. How often do you usually use some kinds of earplugs, earphones, stuff like that? Do you use any while you're sleeping, while you're asleep? I know that for many people who are very sensitive to noise, they might use those kinds of earplugs every night. So do you belong to this category of people? Okay. Well, I might ask you some more questions in the process. So I hope that you'll be able to answer all of them honestly. You can totally trust me. I would never judge you, so you can tell me anything you know. So I'm your doctor, and yeah, you can rely on me. Well, I will put on those latex gloves because for now I'd like to inspect your ears and have a look at them visually, just to see what's going on there in your ear canal. Maybe I see something that can cause some kind of discomfort or even troubles with hearing. So please, no worries. It's not gonna hurt. It's not supposed to, but if you feel any kind of pain or discomfort or whatever, please do let me know right away, okay? So don't hesitate to tell me. I need to know how you're feeling during this exam, and our primary goal is to actually make you feel comfortable and make you feel relaxed as well. And you can trust us here. So your comfort is our primary interest, our priority. So please don't you worry and don't hesitate to tell me if you have any kind of concerns in the process, okay? I'll stop immediately. Well, now let me have a closer look at those ears. I'll give some light to see better. Okay, wonderful. It looks great to me. There's nothing really special. There's nothing alarming there, but maybe there can be some excessive amount of that wax in your ear. Let me see the other one, okay, so that I can come to some conclusion. Okay, so yeah, I guess that it might be this ear. You said that it's a bit worse, yeah? I can see a bigger amount of wax there, so I guess that might be the reason why you have some troubles with hearing. But of course we'll have to inspect them a bit further. Can I touch them slightly? Is it all right? Thank you. Okay, so while talking about your ears, they actually, what if I press here? Does it hurt? Are you sure? Okay. Okay, and now let me have another look. Alright, can you feel my both hands symmetrically on both ears? Good. What if I press here? Right, okay. Well, I will use the tuning fork. Okay, have you ever encountered it? Have you ever had any kinds of tests with this tuning fork? Maybe you had your full cranial nerve exam or something like that. Okay, I will remind you how it works anyway, just in case. So I'm gonna hit it slightly, and you will be able to hear some kind of vibration, like maybe now you can even hear it a little bit. So it might be a bit louder. I will put this tuning fork right behind your ear, like that, somewhere there is a spot there, and you will feel and hear the vibration. Well, probably you will, you're supposed to, and you will just let me know when it stops, when you don't hear it anymore, okay? Then I'll also put it on top of your head, right in the middle, somewhere there. So don't be scared, it's fine, it's a standard test. And you will also let me know when you stop hearing it. And if you'll also pay attention to if you can actually feel this vibration and hear the sound equally on both sides, okay? Good. Well, so I guess that we can start now. If you know all the rules, just in case you have any questions, any further questions, please, you can ask me anytime. All right, are you ready? Good. Right, so you can't hear it anymore. Awesome. Okay, great. now your head, okay? Could you actually hear it and feel the vibration, I'm sorry, on both sides, like the same way on both sides? So it was perfectly symmetric. Are you sure? Let's repeat the whole circle, the whole cycle once again, okay? Yeah, we'll do one ear, then the other one, and then the top of your head, okay? Yeah, sure. So just to be on the safe side, I will know that the results are accurate, that it's not just some random stuff or some kind of coincidence, okay? It's better to check everything twice. Anyway, are you ready? Okay, now you cannot hear it anymore. Okay, great. Ready? Now it stopped. And your head again. Okay, just relax. You can even close your eyes. So, once again, was it the same way in both sides? Are you sure? Okay, great. Thank you. Well, now, I guess we could do the babe test, right? I know that many patients are usually quite excited about it. Well, first, I will put on really fancy headphones over your ears, and then I will actually let you listen to different kinds of sounds and sequences of sounds. And what I want you to do is just to answer my questions, okay? So sometimes you will have to count the amount of sounds you hear. Sometimes you'll just need to let me know when you hear the first sound and stuff like that, okay? It's not gonna be too challenging, I promise. It's actually quite fun. All of our patients enjoy this kind of test. And actually, it will just help me to understand how serious the problem is and if there is any kind of problem actually, because if that's just some kind of wax buildup, that's quite innocent, and that thing can be fixed very quickly. But if there's some kind of cranial nerve problem, then it can be a bit more serious. It's still curable, no worries, but in this case we'll just have to make a few steps in order to actually help you recover from it and to make it work, to make it better, okay? So I will put these headphones over your ears, obviously. What I want you to do is to let me know if you feel comfortable enough, okay? So it will be like that, yeah, on your ears. And these pins, they are actually quite soft. So it's not supposed to press too hard on your ears or something like that. It's gonna be, actually, it's supposed to be very comfortable and soft and nice. But in case if it's not, again, let me know, okay? Awesome. So, if you're ready, okay, would you please lean towards me a bit? Thank you. Okay. Good. Okay, maybe this way. Great. Okay. Okay, does feel good. Good. Can you still hear me? Awesome. Alright, well, now please relax. Once again, you can keep your eyes open or you can close them. It's really up to you. And if you're ready, we can start, can we? Good. Alright, well, now please let me know when you hear the beep sound. You can just raise your hand, nod, or like shake your head, wherever. You can actually tell me, you can tell beep, you can say yes, whatever. I don't really care, just give me some signal to show that you've heard it, okay? I just need to see it right away, okay? Without any delay, to be able to see if you can actually hear it right away. Right, ready? Okay, let's get it started. So, let me know when you hear the beep sound. Okay, good. Now, once again, let me know when you hear the beep sound. Good. Okay. Now, let me know when you hear the second beep, okay? There might be two of them, there might be even more, but I need to know when you can hear the second one. Deal? Okay. Good job. Now, once again, the same task. The second beep, okay? Good. Wonderful. Now let me know when you hear the third beep sound, okay? Good. And now once again. Wonderful. Okay. Now let me know how many beep sounds you actually heard, okay? There can be any amount of them. There can be 1, 2, 3, 4, 5. I don't know. So just let me know how many you've heard, right? Good. So how many? 3. Okay. Let's listen once again. So, how many was that? Just 2 of them. Okay, great. Now, once again. 4 beep sounds. Okay, good job. What about now? So, how many beep sounds have you actually heard? Okay, 5. Right. And now once again. So how many? 2 again? Okay, good. Well, that's quite accurate. Now, I just want you to listen again and please pay attention. If all the beep sounds, all the beeps are the same length, the same duration, or if they are a little bit different. So there can be, for example, all different sounds, or there can be like two sounds of the same quality, of the same pitch, the same length, and one can be different, okay? So just pay attention. I'm pretty sure that you'll be able to notice it, okay? Good. Are you ready? Alright. So, what would you say? The last one was a bit longer. Okay. Let's listen one more time. So what do you say now? The first one was different. Okay. What about now? All were the same. Okay, great. Well, thank you. That's a really excellent result. So far, so good. Well, now let's listen once again and just tell me how many beep sounds you've heard. They can be a little bit different in character. They can be different in kind of like the how loud they are, the pitch, the length, again the duration. So just pay attention, okay? And again, you only need to count them, so that shouldn't be too hard for you. Are you ready? Okay. So how many sounds have you heard? Right. Okay. And let's do it once again. Okay. How many? Alright. Well, thank you. You're doing amazing. There were some really small inaccuracies, a few tiny mistakes. They're not too serious, but that might be this kind of problem you're talking about. So, what I suggest is that we could do a really light ear cleaning and see how it works, okay? So, after the ear cleaning, we'll do a few more tests and we'll see if you can actually hear me better. Not just me, but actually if you can hear everything better. So that would mean that the problem was really just about this earwax, and when the ear canal is unclogged, if your hearing gets really better, it means that there are no other problems. And then if the cleaning doesn't really help, we'll need to come up with some other solution to the problem. Okay? Okay, good. Well, so the ear cleaning itself, it's not gonna be painful, I promise. Shouldn't be. It can be a little bit kind of tingly maybe, and just in case if you feel any kind of discomfort, once again, do let me know right away, okay? You might hear some sizzling sounds, some crinkly sounds in your ears. It's totally fine. But if something goes wrong, I'd rather know right away, okay? Good. Alright, so we will start with a few kinds of drops that will actually soften the earwax, okay? And later I'll be able to kind of like scratch it out with different kinds of brushes and other tools, okay? Alright, well, sounds good. So, can I start? Okay. Okay, good. Alright. I will start with these kinds of drops. They are in a syringe. It's just more convenient to put them this way, you know, to drop them in your ear. But don't be afraid, there is no needle on the syringe, which means that it's not gonna hurt. Alright, so let's start with this one. I will put just a tiny amount. Good. Good. Okay. Do you feel alright? Good. Now let's go to the other ear. Well, I guess that will do. How do you feel? Okay. Yeah, well, it might, spill out a little bit. Please don't pay attention to that. I'll fix it with some tissues later. Yeah, it's fine. Okay, great. Well, so now let me try to scratch it out a bit. We don't need to wait for too long till it softens up. So these drops, they are like pretty cool, and they are very effective. So no need to wait for too long. Yeah, that makes the ear cleaning actually much faster. Yeah. Alright, so how does it feel? Now you might hear it a bit louder, okay? Because I'm gonna clean it a bit closer. So it's gonna be alright, okay? Don't worry. those ears a little bit, okay? While we are waiting for the drops and everything to work. Yeah, okay. I'll be happy to. And now the other one. Good. Well, so now let me use some more kind of like liquid yeah, this is some other kind of treatment, some kind of drops, yeah, or basically it's medicine, obviously in liquid yeah, condition, so that in liquid state. A little bit more. And on the other side again. You know what? I think I'll get you a tissue, paper tissue, okay? Here it is. I will just wipe out the remains of these drops, okay, the excessive amount that's spilling out of your ears. How are you feeling? Good. Alright, do you need any more dishes? I think that I can get you. Okay, well, I'll put them here so that you can get any moment you need. Alright, well, and now let me have a final look. Don't be afraid of this too. It's fine, it's very gentle, I promise. Great. Well, so you actually look so much better. I mean the ears, the ear canal. I can get you this cotton swab, but please be careful with them at home. No need to clean your ears too hard, especially with such things. They're not actually, you're not supposed to do that, you know, because you can make it worse. Yeah, by like accident, you can actually push this earwax even further, and that can also lead to these build-ups. Yeah. So I will just use it for now to wipe out these rest, the remains of the drops. Okay, but please don't use them too much in everyday life, so you don't need that. Okay. Well, I hope that you like understand what I mean. So. Now with the other one. Be very careful, okay? So good. Well, right, so I guess that the ear cleaning itself is basically over. And now what we need to do is to actually see if it worked. So I will make some sounds, some noises. This time I'll do it with my hands, and you will just let me know, like answer some of my questions, okay? I'll give you all the instructions, so no need to worry, okay? It's not gonna be too challenging. Please just let me know how many snaps you hear. You can even close your eyes, okay? 4. Okay, what about now? 3. What about now? 5. Okay, what about now? Just 2 of them. Alright, now please let me know if all the snaps are on the same side or on different sides, okay? The same side. Which one? Okay, good. And what about now? The same side again. Okay, which one? Good. What about now? Different sides. Okay, and what about now? Again on different sides. And what about now? So which side was that? Good, and now? Which side was that? Good. About now? Both sides. Okay, wonderful. Now please let me know when the sound changes the side, okay? No need to tell me which one it is. Just tell me when you can feel the change, okay? Okay, snaps you can hear and on which side, okay? Okay, great. Alright. Okay. Good job. Great. Well, you're doing so good. Okay, now please tell me which of the ears the sound is on. Okay, the sound is in, basically. Good. It's a very slight sound, very gentle, not too loud, but you're supposed to feel it, to hear it. So which side was that? Okay, what about now? So which side was that? Okay. Now, please tell me how many separate brush strokes you can hear, okay? Okay, great. 3. Okay. What about now? Okay, 5 of them. Great. Were they on the same side? On different sides? Okay, and what about now? 4 strokes on the same side. Okay, excellent. The same, but the same side too. Different side. Okay. Now I will whisper some words to you, and I will also create some background noise with my latex gloves. Just tell me what you hear, okay? Okay. Great. Tank top. Snow White. Malt wine. Persimmon. really worked. So now the accuracy of your answers was much higher comparing to the previous one, to the test we did before the ear cleaning. So I suppose it was actually effective for you, and I can also assume that it was the main and the primary reason of those troubles you had. So I guess that there's nothing else to worry about. The test with tune and fork and some other ones showed that the cranial nerves are all right, and that basically it was mostly because of these build-ups you had. So I guess that there's really nothing to worry about anymore, since we have cleaned everything, taken out all these redundant, all this excessive earwax. But I'd like to warn you that it might happen again if you don't take some action. So once again, like I said, please make sure not to use any kinds of earplugs, and please make sure to reduce the usage of earphones a little bit, well, at least as much as it's possible, okay? Okay. And also you remember, please don't try too hard to clean your ears at home. Just you can use water, okay? No need for any special tools, any kind of like cotton swabs and stuff like that, because you can actually make it worse, okay? Please. Well, I do hope that this year cleaning that we have done, that it will actually work, and that next time you come would be just for your regular ear exam, not because of some problems with hearing, okay? So yeah, of course it's better if you do these checkups on the regular basis, but again, like I said, no need to do that too often, in case you don't feel any kind of discomfort in your ears and stuff like that, okay? Good. Do you have any questions maybe? Well, let me put in some data, okay? To the computer, into our database. Okay. So, I will just share really like briefly some of these results of these ear exams and all this tests we've had, okay? Good. You know, many people say that these typing sounds are very relaxed for them. Do you find them relaxing too? Okay, great. Wow, that is actually great. Okay, wonderful. Well, we'll email you all the results. Luckily we have all your data. Yeah, you could confirm it at the reception desk afterwards. I believe that everything is actually on point here, but just in case. Yeah, okay. Well, thank you. Thank you too. It's been a pleasure to work with you tonight. I guess I'll see you soon. Sure.